Did you know you can be paying way more for the same prescription as your neighbor? I'm Hunter Wallace. I am a Army veteran of 5 years, and I'm also a licensed health and life insurance agent in the state of Minnesota. Today, we're going to talk about 3 big topics regarding your prescription drug coverage that you need to know about. The first point I want to talk about is the importance of working with a broker. The reason it's important to work with a broker is because brokers are compensated by the insurance carrier on your behalf to advise you as best they possibly can on your insurance plan. One of the largest abilities that brokers have is to take your prescription drug coverage, put them into whatever tool that they utilize. Each broker has a different one, but that tool they're able to put in your prescription drugs, your pharmacy, your providers, and ensure that all of your prescriptions are covered appropriately on the plan that you select. The reason it's so important that your broker ensures that your medications are covered is because the difference in the cost of a non-covered medication and a covered medication is a substantial difference. What you may not know that an independent broker is aware of, within different carriers, there's going to be changes in drug tiers for each medication. Each carrier handles their drug tiers differently. That's why it's important for you to have a broker to help you understand what's best based on your needs. You might think it's easy to look for yourself, but it's actually very complex. It takes a lot of time and the proper tools to be able to break that down. For example, if you have a medication with company A that's a tier 4 drug, you might have a co-insurance for that. But if you have with company B, it's a co-payment instead. So instead of paying a percentage, you're going to be paying a flat rate copay. It's a substantial difference in cost. Keeping your broker up to date can enable them to make sure that you don't have any surprise costs, like something coming out substantially more than expected. This is important because carriers can change their plans year to year. Next, we're going to talk about how to shop different pharmacies. Many people are unaware that the same exact prescription can have a different price at one pharmacy than it does at the pharmacy across the street. For example, if you go to pick up a prescription at pharmacy A and it costs you $10, it might be over at pharmacy B across the street, it could cost you $50. I know it might not seem like much, but these totals can add up quick. Some Medicare plans also have what's called preferred pharmacies that almost always help you save money. You should always check your pharmacies and see what the price look like from one pharmacy to another before sticking with just one option that you've done out of habit. This might seem simple if you only have one medication, but as your medications expand and you're price shopping across multiple different pharmacies, it's going to take a lot of effort on your part. All the more reason to utilize the assistance of a broker. The next point is the utilization of discount programs. One of the more common discount programs that people hear about is GoodRx. If while doing your drug research you find that you have a non-covered medication, GoodRx might be able to help you find a discount on that medication. Before you spend hundreds of dollars on your medications, check with GoodRx to see if there's any possible discounts that you can receive on your medication costs. Your broker should already be doing this for you, but if they're not, this is a great discussion to bring up to them and find out how to incorporate this into your management of prescription drugs. The important thing to know about these discount programs prior to utilizing them is as you spend money towards your medications with a discount program, that money doesn't go towards your out-of-pocket maximum for your prescription drug costs. So the money that you are spending towards your covered drugs through your insurance plan is still going to be subject to your annual out-of-pocket maximum. As a bonus tip, ask your doctor about the possibility of utilizing a generic if you're on a brand name medication. You never know if there's an opportunity to save some money from switching to a brand name to a generic medication. At the end of the day, Medicare is an incredibly complex subject that honestly, not a lot of people want to learn about. Hopefully some of these tips helped you out. My goal is to help as many people as I possibly can educate and learn and assist them in making the most informed decision they possibly can about their Medicare needs. If you're a veteran especially, I understand the inner workings of the VA healthcare system with Medicare, TRICARE for Life, and all these different veteran systems can be incredibly complex. Don't get frustrated. Please feel free to reach out. I'm happy to help.